Hello, Dr. Johnson. How are you?
I'm doing well. How are you?
I'm fine. Thank you for joining me live out of Dallas, Texas on the Valder Beebe Show. You're here to talk about Stroke Awareness Month. Before I even talk about the month and the awareness of it, what is a stroke, Dr. Johnson?
So, stroke is actually a very common disease in the United States. Around 800,000 Americans have a stroke every year. It's estimated that every 40 seconds, someone in the United States has a stroke. Also, unfortunately, every 3 minutes, someone dies from a stroke. Very simply stated, a stroke is just a disruption to the blood flow to the brain, whether that's from a blood clot, which blocks flow to a certain part of the brain, which is the vast majority of strokes. And also, the minority of strokes is from leakage from a blood vessel, which causes bleeding into the brain.
When one has a stroke, do you survive this, or it depends on what kind of stroke you have?
Exactly. It really does depend on the severity of the stroke. At any rate, no matter whether you survive or not, strokes have caused a lot of disability, even if you do survive. So having a stroke is not only does it kill some patients, it also maims some patients and takes away productive years of life.
When you survive a stroke, is there a percentage of survival, meaning if you have a stroke, you're just automatically going to get 50%, or is there levels of survival?
There are levels of survival. The larger the area that's affected by the stroke, the worse outcome. And also, typically, the older you are when you have said stroke, the worse your outcome. So, at any rate, a lot of people who have a stroke will have some degree of disability, and even outside of that, depression is very common as well after strokes.
This is Stroke Awareness Month. Awareness to me means prevention. Is there prevention first of all, before we get to prevention, are there signs of a stroke? Sometimes.
Exactly. And knowing the signs is honestly the best step of prevention. Because recognizing those signs and symptoms and getting to the appropriate medical treatment is paramount. So, what we do, we talk to our patients, use the acronym FAST, FAST, where F stands for facial drooping, A stands for arm weakness, one arm weaker than the other, or same for the legs. S stands for speech difficulty, difficulty producing or understanding speech. And T stands for time, meaning that if you recognize those signs and symptoms, it's time to call 911.
Is there any group that's more prone to stroke? And let me tell you why I say that. My audience, the primary audience of the 1.9 people that tune in, that listen on social media, that hear me on radio, that see me on streaming, they are born between 1946 and 1964. You and I probably called them baby boomers. Are they in that group?
Exactly the case. Although stroke can happen at any age group from infancy essentially all the way up to the elderly, our risk of stroke does increase as we age. So our audience today is in the prime time for potential stroke.
Since this is Stroke Awareness Month, are there any preventive measures that my group or anybody can take to try to mitigate or reduce the likelihood of a stroke?
True. So the biggest risk factors for stroke are things that we can work with our doctors for. Things like persistently high blood pressure, uncontrolled cholesterol and diabetes, smoking, physical inactivity. Those are the type of things that we can control ourselves by working with our physicians and also lifestyle modifications to help reduce our risk of stroke.
Every time a doctor says smoking, I don't understand it. I don't know if you've seen the price of cigarettes. I have. I
Yeah,
don't know
it's
how people can afford to smoke.
prohibitively expensive, if I can say so myself.
I know, on the body and on the pocketbook. Are there
Exactly.
any breakthrough treatments about stroke? Because we've been talking about stroke since I could remember.
Exactly. So there's been lots of innovation relatively recently. Since stroke is such a disabling disease and one of the leading causes of death and disability in the United States, it's a great target for research and also well as innovation in the procedural space. So all the way from things like the clot busting medicine that you can get in the IV if you go to the emergency room and they suspect you're having a stroke, all the way to what brought me into this space is a procedure called mechanical thrombectomy. What that is if you get to our hospital in the appropriate amount of time, we can minimally invasively go inside the blood vessels and snake a catheter up to the blood clot and either pull that clot out or suck that clot out. And what that essentially does is it stops the stroke in its tracks. And that helps patients recover better and oftentimes fully from their stroke.
What do you mean getting to the hospital, getting to you in time? What does that mean?
So we have a saying in our profession called time is brain, meaning that the longer a stroke is allowed to progress, the more of your brain is affected. Millions of brain cells die every minute we allow a stroke to progress. And sometimes we can get to the point where too much of the brain is affected, where we don't have very many treatment options. But if you get to our hospitals in time and we're able to evaluate you, we have many more medical and procedural treatment options to take care of patients with suspected stroke.
Stroke, probably rated up there with a heart attack. Do you get preferential treatment because of the time factor?
Exactly. Honestly, most of the time, it's such a big deal that if you call EMS, they will call ahead to the hospital and kind of mobilize the stroke team to where everybody's ready to take care of you as quickly as possible. So that's why it's paramount that you recognize those signs and symptoms, call 911, and get to the appropriate place as soon as possible.
So everybody needs to be aware of this procedure, and it can happen to you. So we need to be vigilant as the loved ones, the caregivers, the people that surround everybody else.
Exactly. I always tell people when we have this conversation, you are now the advocate for your family. So you have the information about FAST, the information about calling 911 and getting to the appropriate places. A lot of times the patients won't recognize that they're having a stroke. So it's incumbent upon us now that we have this information to get your loved one to the right place.
And once again, FAST is face, arm, speech, and time.
Exactly. You're an expert now.
I've been trained by the best, Dr. Johnson. Where does my audience go online to get more information?
So I partnered with a company by the name of Penumbra, which is one of the leaders in the neurovascular space, and they have great resources on their website, which is penumbrainc.com/stroke. Also, if you Google the term no stroke, KNOW stroke, the Center for Disease Control and the NIH have great resources as well for patient education and outreach for stroke.
Dr. Johnson, I want to thank you for stopping by the Valder Beebe Show. I talk to people all over the planet, but I love people that have a purpose, and you had such a great purpose today on the Valder Beebe Show. You probably saved a lot of lives. Have a great day.
Thank you, ma'am.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.